I had an interesting sit down with the Aga Khan University Hospital Chief Executive Officer, that is Rashid Kalani. And of course, my first question was how his 2 years of running the hospital as a CEO has been, regardless of the fact that he does not hold a medical background.
Although I am a finance professional by training, but I believe I'm a business leader. I understand the market dynamics. I understand the healthcare industry in Kenya and across East Africa. So that's who I am. I'm a collaborator. I believe in collective intelligence of people. And leading an institution, which is a healthcare institution, you will find doctors and nurses and allied health professionals. These are educated lot, right? So you should be able to have conversation with them. And you can only have conversations with them once you read, once you understand the market. Right? And you collaborate, and then you use the collective intelligence of the people that you work with to take the institutions forward.
Well, the COVID-19 pandemic brought almost everything to a standstill, and this is across the globe. But the one sector that was very, very busy was the health sector. So how exactly did the Aga Khan University Hospital deal with this?
I'll talk about the hospital. I think the first patient which was diagnosed in Kenya was brought to Aga Khan University Hospital. That tells you something, that we are the leaders when it comes to healthcare delivery. So that's one part. And I think not only Aga Khan, that many other private and public institutions, they did fabulous job to serve Kenyans and people of East Africa. So that's one part. And I think we saved many lives. We had to put up many more critical care beds within our hospital. We had to put up field hospital. We had to invest in technology as far as the diagnostic is concerned. So we did very well when it comes to the patient care. So that's one part of the journey. And the second part of the journey, which is very important, is about research, right? What do we learn out of it about these pandemics as well? So we were the only hospital, I believe, which did research on a drug which is called tocilizumab, which was used for COVID pneumonia. When we started, within 2 weeks, we were able to get the patients and we were able to do the clinical trials. And that clinical trial, that research was then published in New England Journal. So not only did we treat the patient, which was important, but also did research on drugs which could treat COVID-19. So that's the second part.
Now, in case of another encounter like this, where does the hospital stand?
I would say, and I have always said this, that life is not a picture, it's a movie, right? And it continues. One scene leads to the other. I think COVID pandemic taught us many things. First is to be resilient. The second is that we have to be prepared for the next pandemic. And the third thing is, and if you look at Africa as a continent, we have been the consumers of knowledge. Yes, there are clinical trials that happen here, but the science originate from 99% of the time from the Western countries. What we are now trying to do is to do research here, right? So now that is our intervention of bringing sustainability of operations. So if the next pandemic hit, are we ready? Are we ready with the science of it? So that's why we have to invest in people, and then we have to invest in new knowledge, that is research. I think that's where it's come from. Then as a country, I think although we did well, but I think there is an increased realization that many of the medical drugs as well as medical equipment, they are not manufactured locally. So then we are at a mercy of getting importations from other parts of the world. And with pandemic, we know with the lockdowns, there were delayed deliveries as well, and the prices skyrocketed. So I think we as a country, we have to invest in industrialization as well.
And his advice to the government?
I strongly believe that it's not government's business to do business. It is government's business to enable the business people to come and invest. That can happen when you provide sustainability of political system, you provide sustainability and predictability in our economic systems. And I think we have been in Kenya, we have been fortunate as a democracy, we have been fortunate to have stable political system as well as economic systems. Yes, there are ups and downs, and any country experiences those ups and downs. Those ups and downs are sometimes are based on internal factors, but they are also based on external factors. If you look at around the world today, the supply chain challenges that we see, the inflation around the world that we see, the environmental challenges that we see, these all challenges impact country like Kenya and other countries as well. So it is I think the government has a role to play to provide a sustainable environment for the investors to come in and invest their money. So political stability, economic stability.
Now on to the university. How exactly does the academic agenda fit into the hospital?
It was a primary care, secondary care hospital for the first 40 years of its life. And then in 2003, 2004, His Highness decided to put a U in our name. And the Aga Khan Hospital became Aga Khan University Hospital. And he did that for a reason. I think we understand it now, that treating the patients is an important aspect of any hospital life. But the important thing is about the sustainability. And how do you create sustainable operations is through educating the doctors and the nurses for tomorrow. So since 2003, 2004, we started the medical college as well as the School of Nursing. I think we are the only private hospital which is a teaching hospital. So we have a medical college and we have a School of Nursing. And this hospital invests close to 800 million shillings every year in academic programs. No other, I don't think, and I may be wrong, but I don't think any other private hospital invests that kind of money in educating the youth for tomorrow. So that is sustainability. And that's what University Hospital is all about.
Like any other business, the health sector also has its fair share of daily challenges.
I think to continue to hold true to our principles, I think that is the biggest challenge. And we see that there are providers or players in this market who are not very ethical, but we operate in an environment. So it is very easy to become unethical and forget about your principles. I think that is the biggest challenge when we talk about competing in a market where there are different players who are at times not very ethical, but we have to stay true to our principles. I think that is the biggest challenge. There are people, my colleagues, who would come, we can get it done this easier way. It is my job to say, our job is not to do an easier way. Our job is to do it the right way. It may be a longer route, but that is the right thing to do. I think that, I would say that is the biggest challenge for me as a leader and for us as an institution.
Staying on Martha's challenges, hospitals are now and again always being accused of negligence. Now when it comes to the Aga Khan University Hospital, how do they deal with this?
Aga Khan University Hospital is a not-for-profit institution. It's not-for-profit doesn't mean it's for losses. We have to have sustainable operations. If you are not sustainable, then how are you going to invest in people? How are you going to invest in research? How are you going to invest in new technologies and new medical equipment? So we have to create sustainable operations. But there are no shareholders standing on my back asking for profitability, right? But then I have to have sustainable operations so I can invest in our academic agenda. So are there pressures on me? Yes, there are pressures on me. But as I said earlier, that it is about doing the right thing, right? The principle of the institution and ethics being one of them is an important aspect of my daily life.
Rashid also shared the company's expansion plans.
There are people and Kenyans who cannot just come to Third Parklands campus for care. So it is our hope that we should go out in the neighborhoods, in the communities and provide the same quality of service. And while we are doing that, we are also trying to lower the cost of care in our outreach centers. As I said, that this main hospital has 800 million shillings every year to give to the academic programs. The outreach centers doesn't have that. So what we are trying to do is to create access for the populations outside.
There's currently a greater focus on preventative care, and this is due to the fact that there was a massive rollout of the universal healthcare. So it's interesting to know how private hospitals like the Aga Khan University Hospital are positioning themselves.
The disease burden for non-communicable diseases is sadly increasing in our part of the world. If you look at the Kenya demographic survey, I think which was published two months back, and it shows that the burden for NCDs are increasing. If you look at obesity, if you look at hypertension, if you look at diabetes, that burden is increasing. So when such diseases are detected at a later stage, there is a pressure on the healthcare system, and then there is a pressure on the patient, and then there is a pressure on the family, there is pressure on the insurance industry as well, financial pressure as well, right? So there is a physical pressure and then there is a financial pressure. So we are now investing big time in preventative healthcare. So many of these outreach centers that I talked about, they do preventive healthcare. Within our hospital, there is a well-being, well-baby clinic, well-men's clinic, well-women's clinic for preventive healthcare. And then we are doing medical camps as well.
And lastly, there's a lot of conversation around renewable energy, and this is what the hospital has embraced in its operations thus far.
If healthcare was if it was a country, it would be the 6th largest emitter of carbon dioxide in the world. So it is very heavy emitter. So we as AKDN, we have a commitment of net zero carbon emissions by 2030. That's at a global AKDN level, and Prince Rahim, the Aga Khan, he is leading that agenda, and he is very focused on that agenda. And that agenda has trickled down to my institution, my hospital as well. So we have now implemented a solar plant for our hospital. We have experimented with 100 kilowatt, but we will expand it to close to 1.2, 1.4 megawatt of solar green energy.
And how's the experiment been so far?
It has been fantastic so far for the past 6 months. I think we started in December, so 8 months. The experiment has been successful and we will be rolling out. And just last week, and that was again very close to my heart and a very successful project, for our boilers, we were using 800,000 liters of diesel every year. 800,000 liters of diesel, and that emit 2,000 tons of CO2 in atmosphere. We have now replaced that with biomass boiler. So starting 1st September, there is no need for diesel. So that is another very significant investment in environment. The electronic health record system that I said, although it is for the clinical needs, but that will also help us save some trees.